Hey everyone, welcome back to CEHHS Unplugged podcast. I'm your host Ariana, and today we're joined by the prep coordinator of the speech language pathology program. Today we're going to talk about their journey into the field, what students should know about SLP, and kind of some advice for anyone interested in the path. So let's get into it. The first question, what inspired you to go into speech language pathology, and what kind of kept you passionate about it over the years?
Hi, everyone. So I got into speech pathology a long time ago, it feels like now, actually from my sister. So my sister was in special education, and I wasn't really sure what I wanted to get into. I went to San Diego State for my undergrad, and I was in the field of biology, and I was unsure really of what I wanted to get into, and I was struggling in some of my academic coursework, and my mom reminded me about how my sister was in special education, and she recommended I take an introduction to communication sciences and disorders class, and so I did, and I liked it a lot. And once I took that class, I realized I had a passion for the coursework and decided to change my major as I think a freshman in college. Not all the classes were easy, but I ended up graduating with that degree, went on to get my master's degree, and I was a pediatric speech language pathologist for about 6 years in Escondido. And then, I would have never thought that I'd become a SLP in academia, but made the transition after working with student interns. So over the years, I've had multiple students, and that's kept me interested, I think, in continuing to work in the field. Just they keep me on my toes and keep me interested, because over the years, things change and we can become outdated if we're not current. Yes, and so with more evidence-based practice, our students learn and I learn from them. And so I've loved the switch into academia, and it's kept me updated on everything.
Hey, that sounds exciting. I have a story kind of similar. I first wanted to do SLP because both of my brothers took speech classes. So that was my idea of going into college. But my older brother kind of switched his major to kinesiology, and I was like, you know what, maybe I want to do that. But I did initially want to do SLP because I thought, I always saw the classes, I always saw what the people would do, and I just always thought that was super interesting. I was like, okay, I want to do that. But I kind of ended up switching my senior year to kinesiology, which is something kind of completely different. So you don't really have that communication that you get in SLPs. But I do think it's a great area because you really connect with the kids. Even in pediatrics, it's super life-changing when you help them either speak or kind of pronounce these words. And I kind of saw what these pathologists do.
Yeah.
Okay. So for the second question, some of the biggest skills that students need if they want to succeed in the SLP field.
That's a good question. So we are a communication-based field, yes. So I would definitely say communication, but not everyone needs to be an extrovert. I would not describe myself as an extrovert, or at least I didn't think I used to be one, but I think over the years I've become more extroverted as I've become more passionate about our field and want to tell everyone about it, because not everyone knows about speech language pathology either. Yeah. But I think communication at some level, right, is important, because that's what we do in our field is communicate. So that would be a big part of it. But I also think creativity. So you can also be really creative in our field. We work from birth to death. And so we have that ability to work with little babies in the NICU all the way up until end of life. And so you can get very creative with the different ways that you work in this field. So working with babies with breastfeeding all the way up until end of life, palliative care. And so all of the different ways that you can work in our field, either in home health, the NICU, like I said, public schools, private sector, hospitals, there's multiple different ways to get creative, but also that level of empathy, because you are working with really little vulnerable babies, people's children, also people's loved ones. And so that compassion and empathy needs to be there too. And I'd say also a level of observation, because you're working with other people. You need to be able to observe, behaviors and communication skills and how people are interacting with one another, and those subtle elements and that critical thinking piece of what am I noticing? What is my next step going to be in that kind of therapeutic realm? And then just that evidence-based kind of thinking, the critical thinking pieces need to be there too. Yeah.
I did not know that SLP kind of falls into the NICU. Do you want to explain more on that? I thought pediatrics is kind of where it starts, because that's where you kind of gain knowledge from speaking and vocal. But do you want to expand a little more about the NICU?
So it's not technically my area of expertise,
Okay.
But my daughter actually had some issues with feeding when she was born, and so I had to ask for help when my daughter was born. And so I have a tiny bit of experience with it. But as far as speech language pathology's role in feeding therapy, we do feeding and swallowing therapy across the lifespan, and it begins at birth. And so when a baby is born and has difficulty with feeding and swallowing, we can work in tandem with an occupational therapist or without one, right? But usually we will work with an OT or, again, independently, and help with that suck, swallow, breathe that the baby needs to do either by breast or bottle. And so there are babies born with cleft palate, cleft lip and palate, or they just have difficulty for whatever reason. My daughter was experiencing jaundice, and so she was really tired. And because of her being tired, she didn't want to eat. So she was just kind of laying there and didn't want to eat. And so they were trying to find ways to help her eat. And so we had to call in. They didn't have an SLP on staff at the time, but the OT came in and helped with feeding. Otherwise, there would be an SLP helping with that. But they often work together alongside the nurses as well. So there's multiple different avenues that SLPs can work with. And then it goes up through from the time that they leave the NICU, right? You can work with different size bottles, right, for the flow. And then once they start introducing different types of textures and things like that, like we've even started doing some feeding therapy here on campus with our graduate students to help them with that skill. So there's a lot of different avenues you can go.
Okay. I'm also planning to be an OT. That's kind of my route. So I did not know that we could work. I did not know those two paths cross at all.
Yes.
Like I thought I'd be in the clinic kind of helping, like I want to go into pediatrics. So I was thinking I would just be in the clinic helping kids, but I did not know I'd cross
OT and
that.
SLPs work together a lot.
I did not know that. That is, and they work in the NICU with the babies. So I did not know that was an option.
Yes.
Kind of.
OT and SLP work side by side all the time. There's a lot of private practices where we will work in tandem. A lot of the speech therapy sensory gyms, like the OT gyms, where kids need to be working on their sensory skills, we will work doing the speech therapy communication side, and the OT will be working on all of the sensory skills building at the same time. So there's a lot of the private practices where we send our students that do OT and SLP at the same time.
Wow. Okay. That completely changed my option. I did not know those paths, and it's kind of funny how like I wanted to do both, and now you kind of can. Thank you so much. I did not know that. All right. So for our next question, how is the SLP program here preparing students for real-world clinical work in kind of grad school? I know you kind of touched on that, but you just want to expand on that?
Yeah. We have a beautiful building over an extended learning building for our in-person programs. So we have a bachelor's program that is live and in-person. We also have an online program. And then we have our prep programs as well that are all online. And so in terms of preparing our students, we try to incorporate not just coursework, but the theoretical foundations, but also the application of learning. And so we do that in a variety of different ways through case-based learning, but also simulations. In our building, if you're in our in-person programs, we have simulation theaters, much like nursing does.
I've seen,
Yeah, so we have 2 simulation rooms that are built for hospitals, and we run them like a hospital room. So they're all set up like a real hospital with a mannequin in the bed, and we make sure that the students are getting that kind of experience in a safe, protected environment. So they're not going to hurt anyone, right? We're doing this in a safe learning environment where they can practice over and over and over again until they build that skill set, and they can go out and do it on a real person without harming anyone. Then we also run other simulations where we have people that we've hired to act as someone else. So say we need an experience where we need someone who is bilingual. We will hire someone to act as a patient, right? A simulated patient. And we have them come in, and they will be bilingual, and we will have an interpreter come in, and the student will interact and build that skill set. So we do a variety of different simulations, even in the undergrad level. We do it a lot more at the graduate level, but to prepare them for that training, we start building those skills in the undergrad level to help them with those skills and application of knowledge. And then we also do things like SimuCase, where we have them watch videos, observational videos of, again, from really little babies all the way up through adults to get their observational hours. We have them go out into the community too. So we have a student organization called NISLA. So we do a lot of advocacy work where they go to local high schools and teach them about our field. So even just talking about what we do helps as well. So there's a lot of different ways that we try to incorporate that.
So you guys are lots of hands-on.
As much as we can.
Yeah. I know that's super good. You guys also do for undergrad, which is not very common. I feel like once an undergrad, you don't really have that experience until they tell you, oh, yeah, you have to go get your master's or do 2 more years, and that's kind of where you learn all your experience. But that's great that this program offers it, just when beginning.
Yes.
All right, thank you. So for our fun question, if you could switch roles for a day and be any other professional, not SLP, what would you choose and why?
I would probably be a botanist. And that was originally, like I said, I was going into biology at San Diego State. So I was really into plants, still am into plants. I come from a family of gardeners, and so I would probably go into botany. I also love to garden, and I think there is some crossover into SLP just because, again, like the observational skills that I mentioned, like watching plants grow. I have some dahlias that are like coming up out of the ground. Nice. All of those elements of flowers and plants, and that's kind of the thing now too, is to have all the different plants in your house and all of that.
Super interesting.
Yeah, I think I would be a botanist for a day. Greenhouse living.
All right. I think that concludes our quick little interview. Thank you so much for joining us today and kind of sharing your experience and advice. I learned a lot. I had no clue that OT and SLP can cross over, which is kind of something that I'm kind of looking forward to now. I'm sure going to grab more information about SLP after this. And thank you guys for tuning in to the CEHHS Unplugged podcast, and we'll see you next time.